I'm going to talk about Gua Sha. Gua Sha is a Chinese term, and Gua means scraping. So we use an instrument. A Chinese soup spoon works really well as that instrument. Traditionally, they used a soup spoon or a coin. So coining was another term for Gua Sha. So Gua is the scraping component, and then Sha is the color that we're going to see come out of the fascia or the myofascia here in the neck and up on the upper neck or the lower neck here. So other techniques now, Gua Sha has been around a long time, a couple thousand years, or this idea where you take an instrument and you scrape along the skin. And so now in modern times, physical therapists are doing what's called grafting. They call it grafting, but it's the same technique of using instruments. So they use these stainless steel instruments here, the grafting technique. And the idea is what we're doing, we're breaking up fascial adhesions. So the fascia is all the connective tissue in between the muscles. And we're breaking up fascial adhesions and scar tissue that form in chronically tense, tight muscles. And as we do this, we'll want to see a red color come up. So I'm just applying an oil on the skin so that the tool can slide on the skin and not damage the skin. So we'll want to see a nice red color coming up. And then at some point, that red color, so we're starting to see just a little bit of red petechia there, right? And then we're going to want to see some kind of purple, like a darker color coming up as we go a little deeper. Now basically what's happening is we're scraping along the skin here, but with pressure. So it's breaking up the fascia with the edge here of the tool. And at the same time though, it is breaking open little capillaries in the muscle here and in the skin. When we do that, we're increasing blood circulation. So those old capillaries break open and the body will form new capillaries, bringing fresh new blood supply to the muscle, to the area. So it's great for chronic tension and chronic muscle spasms. You doing okay, Tiffany?
Yes, it feels so good.
Most patients with tension like the treatment. So now we'll go on top here and more of the trapezius. So the more color that comes up, the more congestion or muscle tension is in the area. So this is a great way to break up those knots that people talk about, the knots and the tight bands in the muscle groups here in the neck. And what's great about this technique is it's very, it's fast, and the results last a long time. So you can see we're getting some good color here in the trapezius, right in this area. And we want to come down just a little bit. Get right where the levator scapula hooks in. To the scapula in there. Get down into the rhomboids. And again, this color is a good sign. So whenever we see this color coming up, we're happy to see that. This will also help flush inflammatory debris out of the muscles, the chronically tense, tight muscles. How's that feel, Tiffany?
Nice.
Yeah, it's good. So that's Gua Sha on the right side. Just looking at both sides.
Good job.
All right, so we just finished Gua Sha on Tiffany and Anna. How'd that go, Tiffany? How'd it feel?
Feels good.
Yeah, like the Gua Sha itself, when I'm scraping, does it feel it's not too bad? Doesn't hurt?
On the left side it hurt more.
And then on the right, though, you said it felt really good.
Yeah, it felt really good.
Cool. Now turn your head side to side and just see how your neck feels.
I feel like I can turn more this way.
Nice. A little more range of motion.
Yep.
Yeah, good deal.
Yeah, feels a lot better.
Okay, thanks.
Yep.